Maybe we'll start. Okay, so maybe we'll start and we'll let people trickle in. So hello everyone, and thanks for joining us this late in the evening. It's always nice to see so many like-minded people want to change the world for good. Before we start today, I want to acknowledge with respect the Indigenous peoples and communities whose historical relationships with the land continue to this day, and on whose traditional territories our work takes place. So today we will be joined by several acclaimed panelists who will be discussing the issue of supply chain within the healthcare system. First, I'd like to introduce Bob Willard. Bob is a leading expert on sustainability justifications, frameworks, and sustainable procurement. Over the last 20 years, he has given more than 1,600 presentations, has authored 6 books, and published 2 white papers. He serves on multiple boards and has received multiple awards for his work. He also provides extensive free open source resources for sustainability. Thanks so much, Bob, for joining us tonight. Next, I'd like to introduce Sunita Chander. Sunita is the Chief of Strategy, Programs, and Partnerships of Supply Ontario, which she joined in 2022. Prior to this, she was Assistant Deputy Minister of the Strategy, Stewardship, and Program Policy Division in the Ontario Ministry of Finance. Sunita brings a solid background in stakeholder management, relationship building competencies, and an ability to translate complex technical policy issues for decision-making and communication purposes. Thank you so much, Sunita, for joining us tonight. Next, I'd like to introduce Karen Belair. Karen is currently the president and CEO of Shared Services West. This is an organization specializing in supply chain optimization in the non-for-profit sector. She had previously held such roles as the COO at the Ontario Institute for Cancer Research, COO at the London Health Sciences Centre and at St. Joseph's Healthcare in London, VP Administration for McMaster University, and VP of Finance and Administration for St. Joseph's Healthcare in Hamilton and for Credit Valley Hospital in Mississauga. Thank you so much, Karen, for joining us tonight. Next, I'd like to introduce Robin Simmons. Robin is the Director of Procurement in Hamilton Health Sciences Centre. She's an experienced procurement and supply chain leader with over 25 years of diverse experience leading and managing large-scale business projects and complex sourcing operations within both the public and private sector. Thanks so much for joining us, Robin. And last but not least, I'd like to introduce our moderator for tonight, Miles Sargent. Miles is a family physician who had also acquired an engineering degree and is currently dedicated to addressing climate change issues. He has co-founded and chairs PEACH, which stands for Partnership for Environmental Action by Clinicians and Communities for Healthcare Facilities, and is the executive director of the Canadian Coalition for Green Healthcare, also known as CCGHC. Just before I'll hand it over to you, Miles, I just want to remind everybody that we'll have a Q&A session after the presentation. Please enter your questions into the Q&A below. There's also a place for comments. So in the chat, please enter comments in the QA questions, and that'll help Miles navigate at the end of the session. So with that, I'll hand it over to you, Miles.
Thank you very much, Gilly, and welcome everyone. Before COVID, I don't know if many people knew what procurement was, but we all learned very quickly, and now these 4 have become rock stars. And I don't know, do you have to wear dark sunglasses when you go out now, panelists? So yeah, procurement is big, and not only was it a big thing during all the supply chain problems that we had during COVID, but now we learn that it is 60 to 70% of the carbon footprint of healthcare. There's power in the personal choices we make when we buy, and there's power in the choices healthcare leaders make in the products that we buy, and that is why this is such an important subject. And I'm going to pass it over to Bob, who, as we said, has been a leader in sustainable procurement for years. Bob.
Thank you, Miles. And I'm going to do a very condensed version of a little presentation that indicates the way in which we can use procurement as a market force to engage businesses in various issues that they are not as engaged in as we need them to be. Specifically, one of them having to do with their greenhouse gas reductions and the race to net zero. I'm in dialogue with the federal government of Canada about how they might go a little further than they already are on this. So a lot of what I'm going to be sharing with you is the same kind of thing that I'm encouraging them to do. So let's just step back and look at the climate change issue and where it fits into the overall concept of sustainable procurement. So a lot of different language is used around sustainable procurement. Some people call it green procurement or social procurement, net zero procurement, circular procurement. Lots of different lenses on what this is all about. And the way in which we use net zero procurement is it's a subset of an approach that would pay more attention to other things than greenhouse gases and energy use, how the people in the supply chain are being treated and so on from a social point of view. But let's start with what is very, very pressing right now, which is the climate change crisis. As most of you know, governments get together periodically at these things called conferences of the parties. Every November, in fact, it's about to happen in the next couple of weeks in Dubai for the 28th time. So every year they get together and they bring their pledges as to how they're going to reduce their greenhouse gases. All of these countries have signed on to the UN framework for the Convention on Climate Change. And they basically are all of the 195 countries that are in the United Nations. So they bring their pledges. So this chart shows how it's going so far. Right now, the world is about 1.2 degrees centigrade above pre-industrial levels of temperature. And what we're trying to get to from the point of view of climate scientists is no more than 1.5 degrees centigrade above pre-industrial levels. So we're getting dangerously close to that limit. When countries come to these events, they bring their pledges. And their pledges, unfortunately, don't add up to enough to be able to keep us down to that level. They only allow us to get up to 2.1 degrees centigrade. And in fact, they're not even living up to those pledges. So it looks like their current policies will allow us to get significantly higher. You get above 2 degrees and all bets are off on how this is going to play out. So this is very, 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 very important. And we need to engage everybody in trying to get to where we are, where we need to be, rather. So the sad fact is that the government pledges that they bring are insufficient, and even though they're insufficient, they're not even living up to them. So they're unfulfilled. And most businesses, rightly or wrongly, are sitting on the sidelines waiting for governments to fix climate change for them. And that ain't going to happen. So what we need to do is engage businesses in setting their science-based net zero targets and meeting those targets so that we can stabilize the climate. So where does procurement come in? We want to use the buying power of governments and large organizations like corporations or like universities or like hospitals as a market force to mobilize businesses in the race to net zero. So the buying power, the power of the purse of large customers, buyers, can be used to get the attention of businesses to pay a little bit more attention and action on issues that we want them to step up to. So this concept of net zero, just as a quick reminder, the Science Based Targets Initiative, SBTI, says that we have to reduce all of our greenhouse gases by at least half by 2030 and all the way by 2050. In other words, zero emissions of greenhouse gases from our operations by 2050, or we're cooked. So very strong marching orders. When we're talking about net zero procurement, what we're talking about is four-part definition, making sure you get best value for money by getting the most climate beneficial goods and services. That is the ones with the lowest carbon footprints, most recycled materials in them, from suppliers who are most committed to science-based net zero greenhouse gas reduction targets. In other words, we're paying attention not only to the attributes of the goods and services, but the companies that are producing those as well, and whether or not they are on the same page that we need them to be in reducing their greenhouse gases down to 0 by 2050. So that part is how we make greenhouse gas reductions matter to suppliers, because the level of supplier commitment to science-based net zero targets is significantly weighted in the customers or buyers' bid appraisals. In other words, they make it matter. That's the hook. So this is the way in which we get the attention of suppliers, because they're going to get better treatment by their customers if they are committed to these kinds of targets. So how would it work? And this is the proposition that I'm putting forward to the federal government. They agree in principle. They're just not quite as committed to it as urgently as I am. But we want to assess all suppliers' ambition on their net zero targets. So we have them fill out a little questionnaire, and we give them a score on that. And we give them bonus points if they use this kind of approach with their suppliers as well. It's voluntary, but we have some teeth in it as well. At bid appraisal time, 10 to 30% of the points that are associated with this particular procurement, enough to matter, are allocated to the supplier scores, and we make sure that they live up to whatever they said they were going to do by terms and conditions that go into the contract. So that's the process. We ask them how committed they are. We incent them to be more committed by having a lot of points associated with their scores on that questionnaire, and we make darn sure that they follow through on it. So what we're trying to do is to try to get the government of Canada to use this. And if they use it with their suppliers, then we encourage their suppliers to use this approach with their suppliers. We start to get some action going on in the business community. And then if we can then take that and roll it out to the provinces and territories and municipalities, so that all of the suppliers that are being used in the public sector in Canada are using a similar system. That CCPI is the Canadian Collaboration for Procurement Initiative, which allows governments to share their processes with each other. And then we take this system and we roll it out to other countries. So at COP29, not the one this year, but maybe next year, we can take this and package it in a way that makes it very easy for other countries to implement it as well. And then we've blanketed the world with this approach that requires suppliers, businesses to pay more attention to this. And hopefully it's going to allow us to get to the reductions that we require. So that's the beginning of a more robust, sustainable procurement system, starting with net zero, which is on everybody's minds these days, and leading it to a more robust system that includes some social things as well as other circular things. And we end up using using procurement as a way to engage businesses in this race to net zero, which many of them are so far ignoring. So that in a nutshell is how we might be able to pull this off.
Yeah, that's great, Bob. Thank you very much. And as we get Sunita's slides set up, thanks again. That does give me a source for optimism, Bob. It's like the ripple effect. The suppliers of the suppliers of the suppliers all the way around the world are going to need to comply, we hope. So,
yes, and the good news is that the federal government's already doing this with their large suppliers, the ones that they do a lot of business with every year. So the principle of using something like this is already established. We just have to get it a little bit more integrated into their entire supply chain rather than just their major suppliers.
Right. Okay, so Sunita, I believe, will be telling us what is going on the provincial level. Sunita.
Yeah, absolutely. First of all, thank you for inviting me. It's a real honor to be on this panel. And as Bob was talking, I was taking lots and lots of notes. So what I'm hoping to do is give a little bit of a line of sight in terms of what is happening within the province. Some of you might be wondering, what is Supply Ontario and what is it that we do? So if we won't move to the next slide, just to give everyone just a little bit of a flavor. Supply Ontario is a newly created agency of the Ontario government. Specifically, we report into Treasury Board. The agency was born out of COVID. It was a really, really hard time for everyone. And all of you were on the front line and experienced kind of the worst of it. And at that point in time, there was a realization, to Miles' opening remarks, like, what is this procurement situation we're in? And boy, can we do it better. So I think that mission of ensuring that Ontario is bringing together its $30 billion worth of purchasing power is focused. And we understand where things are being spent, how they're being spent. So the agency has a very, very broad mandate. Within our legislation, we have coverage of hospitals, school boards, clinics, you name it. There's about 6,000, I'm told, entities. I don't know if I've actually seen the breakdown of the whole count, but it's quite a bit of entities that are under our preview. So in terms of objectives, what we are trying to focus on is, yes, procurement is important, but it can do so much. You see these objectives here. It's not necessarily about finding the lowest cost of a widget. Are we able to create economic development opportunities? Resiliency. Resiliency is a really fascinating conversation that we have internally. There are some suppliers that that there's a monopoly of. So is there a way of bringing a more diverse set of suppliers into the system? We have a very close working relationship with Dr. Kieran Moore, and he's constantly concerned about what is going to happen next, and are we ready for the next thing that is going to happen? So how are we building resiliency within our system and within Ontario? And happily, we'll also focus on sustainability, but I will have to admit we are a long way off in terms of really figuring out how are we going to embed sustainability principles within Ontario procurement. We are in contact with the feds, and Bob, as you were speaking, those were the notes I was taking. Some of those principles, how can we actually build that in? Innovation is another big piece that we've heard. There are a lot of solid Ontario-based health companies that are just not getting into hospitals. They have better patient outcomes, potentially slightly a little bit more expensive, but if it's going to help the patient at the end of the day, how do we bring that value consideration into procurements? I'll talk a little bit more about the economic development as I talk about Bobby. We are still very new. We are 2 to 3 years into our mandate. We're still building up our agency. And, as I'm getting out there and learning more and more, I got connected with Miles and sort of just better understanding the healthcare system. This is an open invitation. If anyone ever wants to come and talk to us, come anytime. We are all ears because we are in a learning mode at this point in time. If we want to move to the next slide, I'll specifically talk about this initiative that was started by the government a couple of years ago, and now it is really truly coming to life. It's the Building Ontario Business Initiatives, Bobby. It's got a great acronym. Sometimes it doesn't work out, but this acronym totally worked out. And the idea behind Bobby is back to those principles and objectives I was talking about. How do we build economic development within Ontario? It's not about being protectionist per se, but it's just being about resilient in certain areas. It's about leveling the playing field for Ontario companies. It's not Ontario companies over everything else, but how do we bring them into the fold a little bit more by using procurement as the tool at the end of the day? So, you'll see our little wheel of benefits, but on a sustainability side, and I'm happy to get some more advice of, we have trade agreements we need to follow. So we can't outright say you must be an Ontario-based company. So how are we going to be creative, innovative in our procurement methods to get some of those other companies in there? What is your carbon footprint? Is there What is your transportation costs? I mean, there's probably a whole host of things that we can include in our procurements, and those are the ideas that we're trying to bring forward and implement across Ontario. I think the rest of this is pretty self-explanatory, but if we move to the next slide, just wanted to give a couple of examples. So one of the things that we're looking at is creating domestic criteria within our procurements, as I was talking about. And here we can talk about things like supply chain security, business responsiveness, environmental consideration, sustainability, local knowledge. And I'm sure the list goes on, and there's probably an incredible number of ideas out there. But the other thing that we're really getting pushed for, and I think this is a good thing, is increasing the weight of those criterion within the procurements. So it's not, all about cost. Right now the guidelines that we're being asked to implement is between 25 to 45%. That's massive. That could have significant impacts on the ground if we implement it right. The other thing I wanted to mention is for very, very large procurements over $50 million, and I'm not sure if that's relevant to this crowd, but we want to take it to the extra step. We want to ensure that they create actual plans that benefit locally, and we want to get a hold of those plans, and we want to track those elements as well. We're hoping, those $50 million procurements are by vendors that are a little bit more sophisticated and are able to throw some economists at these plans. But it's just another initiative that is being brought to life ever so slowly, but they will be announced. Bobby has actually been announced, and the broader public sector procurement putting in the Bobby principles will be in effect January 1st, 2024. So it's an exciting time. I know it's making a lot of people nervous at the same time, but we're trying to get out there and really talk through some of these initiatives with folks. So I'll end it there and happy to take questions at the end.
Thank you so much, Sunita. And as we're switching over to Karen, just a quick question, that 50 million, is this the same federal 50 million?
We were inspired by the federal government, so okay. It is very, very similar to that. Yes.
I see. All right. And so is that mandated now? Are you saying that that's mandated like the feds have done?
Yes. So the legislation, like our Ontario-based legislation, has already been passed. We're still working through the regulations, things like what is the definition of Ontario business. So it's causing a lot of fun debate internally. But the actual directive that hospitals must apply, Bobby principles, starts in January of next year.
So, all right, Karen, are you ready to go?
All set and ready to go.
Okay, great. Go ahead.
All right. And as I'm listening to Bob and Sunita, I'm changing my presentation because you're raising issues that this is a great opportunity to have a dialogue about. So let me share with you a little story about the shared service organizations and GPOs in the province of Ontario. About 3 decades ago, a group of administrators from academic teaching hospitals got together to ask themselves the question, how could we extract more value out of the supply chain? And value has often been equated with lowering the cost. And so it seemed like we'd have a great model of pooling our volumes, taking that out to vendors, and then getting a lower unit price. And I call that sort of the Costco model that we all participate in these days. And so that stuck. That first GPO was created, and organizations would come to the table. Vendors would be happy because they would have known volumes of sales and they would be able to offer better pricing. And we continued to hammer the vendors year over year and contract over contract to give us better pricing. So vendors, responding to how do I lower my cost, had to look overseas to labor markets that were cheaper. And soon we started to lose manufacturing in Ontario and in Canada, and it was all going abroad. Well, a couple of years ago, we went through COVID and we reaped the rewards of driving all of that production offshore. And we realized that we had transferred all of the risk of the supply chain directly to ourselves. And there we sat, unable to procure goods, to have products, to deliver the care that we needed. So the shared service organization, the GPO's role is to facilitate a process. We're not the decision makers about the product that will be used, but we will administrate the process. We'll be the experts in compliance, in the trade agreements that Sunita talked about, in the legislation, and in all the legalities surrounding the supply chain. But we won't be the decision maker on what's actually used to deliver care. That decision is with the care providers, it's with the budget holders within the organizations. So those are the individuals who come to us to tell us what they need. And we help to write the specs and put that out into the marketplace. And we are, in fact, sort of the agent between the user and the vendor. This is a huge opportunity for us to transfer knowledge from one organization to another when we see things happening. And it's also an opportunity for us to get consensus from users. And to Bob's point, how do we interact with vendors? How do we get them to drive this agenda? We need to do it by all being on the same page, so that those 6,000 organizations that Sunita's talking about don't have 6,000 different ways to attack this problem. And so that's where we sit today with our organizations, is trying to get consensus on how to go forward on this. But we're still stuck in this, how do we drive more value in the supply chain? And I just want to share with you one slide, because value for years has been cost. And that's the tip of this iceberg. And that's what everybody saw for decades, just the cost. Now we talk about value in terms of quality. We talk about it in terms of patient outcomes. And most importantly, these days, we talk about it in terms of risk. How do we ensure that we have a robust supply chain? To Sunita's point, how do we ensure resiliency in our supply chain? So as we look below the surface, there are all of these competing priorities, and depending on your perspective as a healthcare provider in the system, where you sit, your attention focuses on various elements of the supply chain. So for many of us, we are looking at risk, everything through a risk lens these days. And we haven't yet decided on how much the ESG agenda is going to find its way into the procurement. And, you know, Bob spoke about, you know, a 30% scoring. You know, you got 100 points to give out when you're scoring a procurement, and you want 30 of those points to go towards ESG. Right now, we're less than 5, or we might be at 5 points, and we're just starting to write language into RFPs that requires vendors to showcase their commitment to sustainability, and we're giving them a few points for that. And now we're going to have new legislation in Bobby that is going to want us to provide points for Ontario-based organizations. So you can see that there's tension here. And how we score, how we evaluate proposals coming in from vendors, it is going to be a challenge over the next few years. I would like to say that we've got it figured out, but we certainly don't have this figured out. So what I want you to take away from this today is that you, as individuals who are care providers or individuals that are making decisions within these organizations, need to use your committees, and many of you now have sustainability committees in your organizations, to think very carefully about how you want to define value in your supply chain. And then as a shared service organization, we work across the entire province, across all of these organizations, to find consensus in that And then we can have one voice that we will use when we go out to vendors. And so it's not confusing for them. And that's where I'm going to stop tonight.
Okay, that's excellent. Thank you, Karen. And you bring up a great point about, I guess, what I would call the corporate green team and how much power that gives the procurement person to make decisions. I also see that there are no questions yet. So if you do have questions, please put them in the Q&A or the chat. It will even give our panelists a minute to think about the question before they answer it. And speaking of corporate green teams and procurement, I will pass it over to Robin.
Thanks, Miles. I'll start by saying procurement's funny. I've been in procurement for 25, 27 years now. And during all that time, no one in my family knew what I did. No, my friends, my family, nobody understood procurement. It's like you talk about your job and it goes way over their head. It was COVID that actually brought procurement and supply chain into, people started to think that it was sexy, right? It's interesting. And now they understand. Now everybody knows what we do. So that's kind of the flip side of it being a benefit to COVID. Now everybody knows what we do. I also just want to comment, the speaker order for this webinar worked out really well because we had Bob talk about sustainability and that from a global perspective. And then Sunita talked about Ontario's, then Karen brought it down to the shared services organizations. And now I get to talk about what it means to the actual hospital or to an individual entity that's trying to implement sustainability into their organizations. And I'll be honest, it's not easy. I wish I could say it is, but it's not. It's the right thing to do, but it's not the easy thing to do. But we can do hard things. So we've just got to start somewhere. I'm glad that Sunita brought up Bobby and the 25 to 45% weighting on RFP and sustainability criteria. Karen made a really good point too of saying, it's been hard. Some organizations are at 5% if we can even get it into RFPs. At the hospital that I work within, we did a test, I want to say a pilot of an RFP for contingent warehouse services. It was interesting, and I'm going to share with you some of those lessons learned that came out of it. But I'll start by saying that we decided to do this because it was non-clinical, understanding that once you get into clinical or even like any other specialized products that an organization relies on in their day-to-day operations, it's difficult to present sustainability requirements and weightings in excess of 5%. Because stakeholders are really concerned that they could lose their strategic vendors that they currently have contracts with. They're concerned that they'll lose the vendors that they like because of such heavy weighting. Going back to the contingent warehouse RFP, we did build sustainability language into the RFP. What we did is we created a set of questions, and they were both related to sustainability as well as our diversity, equity, and inclusion directives. These are part of Hamilton Health Sciences North Star objectives. So it made sense that we would create some language in our RFPs for this, but we needed to pilot it and see what the results would be before we actually implement it as a go forward strategic initiative. So what we found out was, so let me just step back. We also decided to weight this at 10%, which was a big deal for us. The reason we were able to do this was because the contingent warehouse RFP is something that I actually directly manage. So I'm the key stakeholder and I could actually make this happen. Having said that, now I'm going to share just one slide with you to just share what our lessons learned were coming out of this. So the first lesson learned coming out of this is that we needed to identify the right people to score the RFP responses. To have someone in procurement do the evaluations of a vendor response was really less than helpful because we're not the experts. Having a green team in the hospital, that would be the ideal type of person to do the evaluation. Clinical evaluators, they don't know what they're looking for unless they're very committed to sustainable products and looking for green products to come into the hospital. So having the right knowledgeable internal resources do the evaluation is really critical. The other thing is we asked way too many questions. We actually, on the sustainability piece, I believe we asked 12 questions that were really geared towards warehousing specifically, but also some very generic questions. What we found was they were very open-ended and, we weren't really getting really great responses. So my suggestion is to pare it down to really specific questions, but also know what you're looking for in a response. If you just ask a question for the sake of checking the box on sustainability, it's not serving anybody, right? So know what you want to ask and then, keep it very, very tight. We also needed to provide instructions and questions. We need to provide more clarity on what kind of responses we want to see. For example, we asked vendors, do you have a policy supporting sustainable operations within your organization? The response we got was probably many, many pages worth of copy and paste into the RFP response about that company's global operations. What I needed to see in that was really to tone it into what are your sustainability operations within the warehouse that you're proposing for me to use, the one down the street here in Hamilton. What are you doing for that warehouse? Open-ended questions, not great for responding. Again, they need to be simpler. We also need to provide more direction on the type of responses. Do we want data? Do we want certifications? Do we want evidence on what we're looking for? Simply asking, are you certified? Are you LEED certified, for example, versus please provide your LEED certification documents. So we're going to start to ask for the actual certifications because we have no way of validating that. The weighting needs to be flexible and specific to the RFP category. Here's where we get into issues on, for us in a hospital, what is clinical versus non-clinical. And again, are we willing to lose a clinical vendor, over sustainability that the vendor may not actually answer appropriately? They might not provide an accurate response or something that actually does them service. So we really need to be flexible on the type of weighting that we're looking to implement within the RFP. And then looking at education for both the vendors and the evaluators as we move through trying to implement sustainability into our RFPs and into our contracts within the organization. So those are my lessons learned. Like I said, it's not easy, but we are committed. And I think, like I said, we can do hard things. And, we're also relying on each other to share lessons learned and, evidentiary case studies that will help us to bring more sustainable products into the organizations as well.
Okay. Thank you so much, Robin. And Robin, as you know, it's been an absolute pleasure working with you at HHS. I think we're lucky to have you at HHS. You're so committed to this issue. I think I'm going to the first question here. Is Millie's the first at the top, or did I miss one above that? Let's see here. Okay. Oh, no, there's one. Okay, Gilly. Gilly's question to Sunita. She understands local is top priority, and I think that's referring to Bobby. What is the weighting of carbon footprint within the decision making, or is there any at this point?
At this point, we're not specifying, at least in the guidance and the training material that we plan to put out. And I think this is where, to some of the speakers' point, like, we can't also go off and do whatever we want as well. I think we're more powerful if we do it together. So, you know, this is a good feedback for us, because if it's helpful for Supply Ontario, for example, to get into a little bit more details of what could be expected, then I think that's a conversation we should have. But I also don't want procurement professionals to feel so tied to whatever it is that we're suggesting. I'm very cognizant of the fact that we are an agency of the government. So sometimes whatever we kind of put out there, people feel like they absolutely have to follow it. And that's not the case. There is flexibility built into this. So I think it's a conversation, but we do want to keep it flexible and nimble for those on the ground. To kind of do the best they can, because those are some tough numbers and criteria that we're suggesting.
Miles, if I could just add to that,
Mhm.
because of the disruption that we had over the last few years, the certainty of product availability is one of the top requirements right now. So
Yeah.
Yeah, actually, can I just say something about that too? Right now, we are very challenged on, so I'll give you an example, single-use plastics. So this is a big topic right now, and we can go through an RFP and we can contract with a vendor that provides us with sustainable products, but can they deliver them? This is the challenge that we're having with these single-use plastics right now, because vendors weren't prepared for the larger requirements, right? They prepared for, say, retail single-use plastics, but not for hospitals, not for other like long-term care. So we're challenged because I've got hospital programs that are calling me on weekends and nights saying, I have no cups, right? I have no cutlery. Can you go to the store or go to Costco and buy me some? And what's on the shelf? Well, there's still legacy styrofoam, but we've got nothing that we can provide. So the supply chains are still fairly broken, whereas we need to, as Karen said, we really need to focus as well on, the stability of the supply chain and being able to actually get products in.
Mhm. All right, I'm going to move to the next question from Millie. What suggestions do you have to convey the importance of sustainable procurement to businesses and healthcare systems who currently do not practice this and do not seem interested to engage? Bob?
Oh, so you're giving me the easy questions.
I just remember I said I wasn't going to do that, but I just did it. And go ahead, Bob.
Okay, it's a great question, and the "what's in it for us" question is very appropriate for any organization which is a large procurer. When we encourage them to engage with sustainable procurement, normally the rationale for it has to be aligned with something that they already care about: strategic objectives, strategic goals, targets, whatever. Because there's more and more accountability now for companies to not only pay attention to what's happening in their own operation, but also the indirect impacts of what's happening in their supply chains. So as we take a look at something like greenhouse gases, for example, it turns out that most of the emissions are coming not from the company's own operations, but from its supply chain. Usually it's about a 90-10 or 80-20 split, which is only 10 or 20% from their own operations, and the rest of it's coming from their suppliers. And they're being held accountable for that. So their scope 3 emissions, they're being held accountable for that. It's driving them nuts. And the way in which they can start to get their heads around what's going on out there is through the procurement function. The procurement function interfaces with the suppliers and can collect appropriate information, data, metrics from those suppliers to help the company understand how it's doing, not only in its own patch, its own operation, but also in its value chain, which includes the suppliers as well as the customers. So the recognition that companies have a responsibility to pay more attention to what's happening elsewhere is really being codified now by governments around the world. California is way ahead of us, of course, as usual. So is Europe. Europe has just passed a requirement for large corporations to do a due diligence disclosure every year, annually, on what's not only happening in their own operations, but also what's happening in their supply chains, and doing an annual report on that requires them to not only identify those hotspots, but do something about them. Work with suppliers on mitigating some of those risks. So this is not something which is optional as much as it used to be. This is something which is becoming much more the norm. And as companies become more and more accountable for what's happening in their supply chains, the role of procurement as a vehicle by which they can start to get more information from the suppliers becomes more and more important.
And does anyone want to add to that?
I was just going to say setting expectations as well. And I think this is where, regulatory legislative tools sometimes can be heavy-handed, but if we use it correctly, it signals to the market what the expectations are from kind of whatever the jurisdictions are. Sometimes that's tough to do. Even with Bobby, we're just launching it. It'll be really interesting to see, as people take it up, we're going to get tons and tons of questions. We're going to work through it together. It's going to be a bit of a journey, but it's just starting to push some of those expectations and buttons a little bit.
Maybe it's just me, but I just love the name Bobby.
It does roll off the tongue.
A couple things. One, if we go past 9, we will stay on. At least some of us will stay. That's news to the panelists. I hope you'll stay on for a few more questions. Wanda Page raised her hand. And Kita, what do we do about that? Can Wanda chat with us here?
She can. Give me one moment.
Okay.
Wanda, you should be able to unmute yourself and speak.
Yeah, sorry, that was 100% a technical glitch. I apologize. I'm trying to get it down now as we speak.
Hey, Wanda, you got to say something now that you're on.
Hi, everyone. The presentations are awesome. I'm enjoying the evening. Thank you.
Okay, thanks for coming, Wanda. And we have another question for Bob. Does circular economy play a role in requirements from vendors?
Absolutely, especially if you're interested in greenhouse gas reductions and so on. Circular design and net zero design are joined at the hip. A lot of circular design and principles avoid the extraction of virgin material and the refining of that virgin material and converting it into parts and so on and making it into products. If you can avoid all of the carbon footprint associated with those early stage extraction and refining steps in the manufacture of products, that's fantastic. And circular economy allows you to do that because you're reusing parts, you're reusing materials, in some cases the whole product. So you can reduce your greenhouse gas footprint associated with a product by up to 40, maybe 43% by using circular economy principles. So yeah, circular economy is really, really, really important as a part of all of this. And we need to get much better at that, especially in the area of plastics.
Anyone else want to comment on that? No. Okay. I've asked Rob to clarify because I don't does the panelists understand? I would like to see the process simplified 10 to 20% carbon footprint. I'm going to let Rob clarify that one, and I'll jump to his second question. What are your thoughts on England NHS net zero procurement? It seems too complicated. They have I know NHS has their there's this one page of supply chain, kind of a graphic. Karen, are you familiar with what you made the mistake of nodding your head? Has that, do you know what I'm talking about, Karen?
Yeah, they have come out quite aggressively with targets.
Yep.
It's a system. And we haven't yet organized ourselves into a system to be able to do that. So it would provide some motivation if we had that conversation and what that needs to be. I'm not going to suggest tonight, what that target would be, but I do think that conversation needs to take place. So in the same way that we're talking about building Ontario businesses and that initiative, I think Supply Ontario could play a role in this conversation and potentially set some targets around procurement across all of the sectors. And we need to do it collectively so that it has an impact with vendors.
And a question from Rob, which I think I asked last year, Robin, to a group of procurement leads. Why can't we do 10 to 20% weighting of sustainability on our procurement contracts? I think people laughed at me when I said that last year, but
Yeah, because it's hard to do, right? I think I mentioned it. Are we willing to lose a vendor, right, for such a heavy weighting? And then there are our leadership, or it's hard. It's just hard to get leaders to agree to put that weighting in there. Like Karen said, procurement people facilitate a process. Right. Ultimately, it's the stakeholders that we're running the process for, the decision makers. They're the ones who have the ultimate decision on how much weighting we put on something. Some RFPs will put a heavier weighting on price, for example, whereas others, like IT related things, are highly technical. There might be on threat assessments, things like that. What I would say is it depends on what you're sourcing. And procuring.
And Miles, you would know this, that there are certain surgeons who will only use certain types of hips.
Right.
It could be the worst company on the planet, but if that hip is the best hip, or that pacemaker is the best pacemaker for their patient, that's the one they're going to use, because their focus is on the quality of care and the outcome for the patient.
Yeah. All right. How do we tackle the reluctance that companies, institutions may have to conduct research and development efforts to innovate more sustainable products if there will be a lack of uptake of these products due to supply chain barriers?
Well, I'll start with this one. The product cannot be looked at from one perspective, one element. And so this is the issue that we're having with Bobby too. Just because you live in Ontario and you've got a business here doesn't mean we're going to buy those products and use them. It has to be seen to have value for its purpose. So it has to address not just the cost, not just the quality, patient outcomes, the sustainability, all of these things have to be addressed. It can't be totally just weighted in one area because it's not going to be used. And so that's, we have to get people on the same page.
And in addition to that, if we're talking about clinical items, then we're also we can't bring a clinical use item in without a medical device license. Right. So there's all these other things that are required as well.
So my question that I put in here, I'll take the privilege of asking my own question. What are the other sectors doing in Canada outside of healthcare? And actually, Sunita, I'm kind of curious from the Supply Ontario perspective, are other sectors out there doing better, universities, municipalities, et cetera, better than healthcare?
So I know the city of Toronto's got a pretty robust, I'm going to call it sustainability parameters that they try to follow, including diversity and inclusion and equity. So I've had a few conversations with their chief procurement officer, and they've had it in place for a couple of years. But what's really fascinating is if I ask, have you seen improvements, or kind of what are the KPIs? Those are really difficult to answer. So I think they're still thinking through the policy parameters, and trying to make sure it's reaching the outcomes that they want. We've had a few conversations with the Fed, but we haven't been able to kind of dig deep into some of their work. Quebec, I know, has moved pretty quickly on the economic development side. So I know they have a version of Bobby as well within the province that they're tracking. They're claiming lots of success on that front, but I'm not very familiar with the rest of the jurisdictions, unfortunately.
I can just chat a little bit about the academic sector in terms of colleges and universities. This is where the voice of the student is very powerful, and they tend to drive a lot of change in those institutions. So very early on, universities and colleges have taken up the carbon mandates, et cetera, getting to net zero. I think today you would have seen Mohawk College come out with a very aggressive announcement on what they are doing, and they have one of the first net zero buildings on their campus. And so there's lots to be learned from other sectors, and Supply Ontario can play an excellent role in sharing that, across all of the agencies and sectors within the government, so that we can take advantage of that. And, you're seeing I appreciate that hospital redevelopment. We do procurements for hospital redevelopments. You're now seeing that language around carbon footprint and net zero in the new build for organizations. So that's slowly coming to fruition. It's taking time because it's more expensive. And whether you're in the academic sector, in the healthcare sector, wherever you might be, there's a certain amount of money that you have to raise for those kinds of projects. And that sometimes it makes you not get to, a net zero building, but, LEED silver building.
Yeah.
Just building a little bit on what Karen and Sunita said, the academic sector and the municipal sector are really doing some neat things on sustainable procurement. There's an organization called the Canadian Coalition for Sustainable Procurement, CCSP, headed up out of Vancouver by Reeve Consulting. And most of their members are municipalities and colleges in Ontario, and a couple of universities as well. I'm on the board of the Sustainable Purchasing Leadership Council in the US, and we've got about 140, maybe 180 members now. And many of them are universities in the US, as well as governments, state level and federal level. So there's good action going on there. I'm part of an effort to have all 24 colleges in Ontario use sustainable procurement going forward. That's a 3-year effort that Reeve Consulting is heading up, and I'm helping that effort a little bit as well. So there's a real concerted effort in some of the pseudo public sector organizations that seems to be going in the right direction.
I guess one of the questions here, difficult to quantify how much impact this is having at this point. Is that fair to say?
Yeah, not enough.
Okay.
We're trying to change behaviors. We're trying to use procurement as a lever, as a market force, to change the behaviors of the suppliers, to change in some cases, the business models of suppliers. It's a fantastic untapped market force, and we need to be thoughtful, but more aggressive on exploiting that.
Okay. All right. What are some ways for medical students to get involved in this work with Peach, CAPE, or OMA? I would love to find ways to delve further into this side of healthcare. Millie or Gilly, do you have anything to say?
I don't know if you mean specifically regarding procurement or overall regarding green healthcare. If you mean overall regarding green healthcare, you're welcome to join us. You're welcome to email us and or join our OMA Connect link. And I can put, Max, if you want to put our email in the chat.
And likewise, I see Namra's clarified she means overall. And yes, I'd also say, a warm welcome to CAPE if you wish to join us. We have many, sort of learners amongst us with a lot of different roles to play and a lot of energy and enthusiasm. So we would really welcome you to join and other students.
Yeah, and from Peach, I would say the warmest welcome of all. You're
Oh, we're going to fight over you now, so lots of options.
Yeah, sure. Reach out to you've given ways to reach out there, Max. Right. So yeah. Excellent. And the other one, one more that I wanted to ask was the accreditation question from Rob. Could the accreditation process, and by the way, for hospitals in Ontario, I think, gosh, has it been a year and a half now that there are accreditation standards around sustainability? They are not particularly strong yet, but they do exist. Could accreditation process be better leveraged to encourage hospital institutions to opt in? I think they means opt into sustainable procurement. Is that how would that work at a hospital level, Robin?
So we just went through accreditation. We just completed with exemplary standing, I would say. We, from my experience, I'm not actually been very involved in accreditation. They don't tend to pick on procurement that much. So I think it's a great place to start. Accreditation is mostly around patient care operations. So I've not really seen that yet. But again, I wasn't really deep into the accreditation.
Yeah, fair enough. But I guess I would say to Rob that, gosh, if something did exist, if Accreditation Canada actually said, look, how are you scoring contracts and are you including sustainability, then you'd have to comply, right?
Oh, absolutely. Let's go back to that old phrase, what gets measured gets managed. And so to the extent that something's going to be measured in your accreditation, yeah, people are going to sit upright and do something about it.
Yeah, I saw a comment in the chat. It was really a great idea about Health Canada requiring greenhouse gas emission. I think that's what it was on their labeling of healthcare products. Somebody made that comment. I thought that was amazing. That would be fantastic.
Yeah, that's Rob. He's been talking about that for a bit.
Yeah, I love it.
Wow.
Yeah.
Wow.
People like that. Is that possible? Bob, you're laughing.
Anything's possible if you decide to do it. Sure.
Yeah. It looks like Rob has come on. Rob?
Hello.
Yeah. Hi, Rob.
I'm the chair of the Ontario Nurses for the Environment, and I've been working with Miles as well as with Kane to try to get both carbon labeling through Health Canada on Health Canada labeling, and if anybody has any leads to get in with Leslie Thompson with Accreditation Canada, that's another thing that I'm really looking at pursuing, because that goes across 13 health jurisdictions across Canada, and it could be legislated, but it also could be non-legislated and included in it, and it doesn't necessarily require political backing, even though political backing could help it get into that. So if anybody is interested in helping with that, I'm very interested in talking with you.
All right. Rob does not give up easily. I'll tell you that about Rob. And so thanks so much, Rob. And because we're getting toward the end, were there any questions on there, panelists, that you saw that you were hoping I'd ask you and I haven't gotten to? Or any other final comments you'd like to make? No? Okay. All right. Well, thank you, attendees, for coming. And thank you so much to all the panelists tonight for taking the time. It's a little bit late. You all did a great job, and you're all doing amazing work out there. So have a great night, everybody.
It's a pleasure.
Thank
Thanks
you.
for organizing this.
Thank you, everyone.